The frontal bone in an adult is an unpaired bone that is a part of the bony structure that forms the anterior and superior portions of the skull. Frontal bone consists of the 6 parts. 1. Squamous part. 2. Orbital part. 3. Nasal part. 4. Zygomatic part. Now, let's talk about each part in detail. 1. Squamous part. The squamous part forms the largest part of the frontal bone. It is composed of 2 surfaces, an external and an internal surface. The external surface. The external surface is convex, and they forms the forehead and the anterior part of the vault of the skull. Now we will study the external surface of the squamous part of the frontal bone from 3 views of skull. 1. Anterior view. 2. Superior view. 3. Lateral view. If you look at the squamous part from the anterior view, you will see many features such as frontal eminences, or frontal tuber, are the most prominent parts of frontal bone. Superciliary arches. Thick curved ridges lie little above the medial portions of the supraorbital margins. They are well developed in males and less marked or even totally absent in females. Superciliary arches which join to form the glabella. It's smooth area of the frontal bone, and it's located just above the root of the nose. The supraorbital margin. Its angular boundary between the squamous and orbital parts, and which form the upper boundaries of the orbits. The supraorbital notch is present at the junction of sharp lateral 2/3 and rounded medial third of supraorbital margin. The morphometric variations of the supraorbital notch, or foramen, are not uncommon. The knowledge of these parameters is important to preserve the neurovascular bundle during surgery in this area. Supraorbital notch or foramen transmits the supraorbital nerve, artery, and vein. The supratrochlear foramen is the small opening at the medial edge of the superior orbital margin in the frontal bone that transmits the supratrochlear nerve, artery, and vein. The frontal sinuses are the paranasal sinuses within the frontal bone. They are lined with mucus and are most often 2 in number. We will talk about frontal sinuses in detail in another video. After we learn the features of the external surface of the squamous part of the frontal bone, let's learn what the articulations of this part of the bone. It articulates with the nasal bone on either side of the middle line by the nasal notch, and the suture between the frontal bone and the 2 nasal bones called frontonasal suture, and articulates with the frontal process of maxilla by nasal notch. The frontomaxillary suture is the suture where the nasal part of frontal bone joins the frontal process of the maxilla and with the lacrimal bone. the frontolacrimal suture located between the frontal and lacrimal bones. With zygomatic bone by the zygomatic process of frontal bone. The frontozygomatic suture, also known as the zygomaticofrontal suture, is between the frontal process of the zygomatic bone and the zygomatic process of the frontal bone. At birth, the frontal bone is composed of two symmetrical halves, which are separated from each other by the metopic suture. The metopic suture separates the two frontal bones at birth and is the first skull suture to close physiologically, starting as early as at 3 months and generally being completely fused at the age of 8 months. Now, let's begin with superior view. The frontal bone articulates with the paired parietal bones at the coronal suture. The bregma is the midline bony landmark where the coronal and sagittal sutures meet, between the frontal and two parietal bones. It is the anterior fontanelle in the neonate and closes in the second year too, typically around 18 months after birth. In the lateral view, the frontal bone has an involvement in the formation of the pterion, a joining of 4 cranial bones: frontal, sphenoidal, parietal, and temporal. We finally finished the external surface from 3 views of skull, so let's start with internal surface. As we see in these pictures, the external surface of the squamous part is smooth and convex, while the inner surface is concave. The features of the internal surface include sagittal sulcus, a vertical groove in the midline of the frontal bone. It contains the superior sagittal sinus. Frontal crest, extension of the sagittal sulcus edges, forms an attachment for the falx cerebri. The frontal crest ends below in a small hole called the foramen cecum between the frontal and the ethmoid bone. The foramen cecum does not usually transmit any structure but may transmit an emissary vein from the nose to the superior sagittal sinus. Groove for anterior meningeal artery, branch of anterior ethmoidal artery. Now we complete the largest part of frontal bone but still have 3 part remains. 2. Orbital part. The orbital part is composed of 2 thin, orbital plates separated by the ethmoidal notch. It have 2 surface. The inferior surface. The inferior surface forms most of the roof of the orbit, and the superior surface. The superior surface forms the greater part of the floor of the anterior cranial fossa. The inferior surface of the orbital part is smooth and concave, and it features. The anterolateral portion consists of the lacrimal fossa, where the lacrimal gland sits, whilst the anteromedial portion contains the trochlear fossa, an area of attachment for the pulley of the superior oblique muscle. The superior surface is convex and contains depressions for cerebral convolutions. It articulate with ethmoid bone via ethmoidal notch, and the suture between them called frontoethmoidal suture, and it articulate with lesser wings of sphenoid bone posteriorly, and the suture between them called sphenofrontal suture. 3. Nasal part. The nasal part is a small portion of the frontal bone that projects inferiorly between the right and left supraorbital margins. The main feature of this part is the nasal notch that serves for the articulation with the nasal bones and frontal processes of the maxilla. Projecting from the central portion of the nasal notch is a median process known as the nasal spine. The nasal spine supports the bridge of the nose. 4. Zygomatic part, or zygomatic process. The zygomatic processes project inferolaterally on each side of the squamous part of frontal bone. They begin at the lateral aspect of the supraorbital margin and end at the zygomaticofrontal suture that connects the frontal bone and the frontal processes of the two zygomatic bones. Now, before we move on, press pause and try to identify all the landmarks you can see it in surface anatomy. Now, let's view on this normal radiographic imaging of the skull for adult and pediatric. In the fronto-occipital view, AP view, you can see superior orbital margin, frontal sinus, coronal suture, sagittal suture. In occipitofrontal view, PA view, you can see and in the lateral sinuses view you can see, of course, the frontal sinus. Now let's move on to pediatric X-rays. We will talk about it in another video, and now we start with the CT scan. We can see frontal sinus clearly in CT scan, in coronal CT view, and in sagittal CT view. We can clearly see the frontal bone in the 3D CT scan, so we can see every part of the frontal bone and compare it with the skull of newborn and pediatric. Please be careful, this is not a skull fracture, it is a metopic suture. You will see it from the time the child is born until it fusion in the 8th or 9th month, and you can see the bregma which fuse at the age of 2 years. Clinical relevance. Like frontal bone fracture. Fracture in frontal sinus. And frontal sinusitis.